Here we are talking about whiplash, and you're just driving along, having just the best day ever. Rainbows, unicorns going off in the brain, and lo and behold, someone behind you is checking their fantasy football and they want to see if they're winning $5. They smash you from behind. Your classic whiplash is actually a hyperextension of the neck and then a quick hyperflexion as well. It can cause some significant sprain and strain on all the spinal ligaments. With the spine, there's 24 gorgeous vertebrae. There's a nerve root on the left and right that exit all the way down and then go to every cell in the body. Crucial is the curvature of the neck. Whiplash is left uncorrected, the head will start to drop like this as that curve straightens. And so what will happen is these muscles in the anterior portion of the neck become too tight. Let's talk about a couple wonderful exercises you can do at home. They're going to help correct this whiplash for you. You're going to take a couple of fingers just like this over our clavicle, that's this shoulder bone here. You look down, put a little pressure on that clavicle, then slowly start to look up like this. And as you do, you'll feel the stretching happening in the anterior cervical compartment. And you can move those, as you do repetitive sets, you can move those fingers around to help out. There you go. Oh boy, that feels good. All right. Do not ever exercise these muscles. They are way too tight. So these muscles right in here will pull the head forward like this. That's what happens when you have a whiplash, and we need to relax these muscles. Next, the posterior. If the head is doing this, well, the posterior muscles are getting stretched all day, and they are just in agony. They're fighting, and it's going to create this big bump back here. Tremendous amount of inflammation. Any of you have had whiplash, you know what it feels like. It's miserable. We need to actually strengthen those muscles. You're just going to take a couple fingers and a little pressure on the chin and go straight back like this. And then just hold it there for a count of 10. And right now what I'm feeling is some tension and tightness in the back of the neck. That is good. That's what we want. We want those muscles to strengthen or be exercised for us. Now, things not to do. Don't bring the head up like this or down or subluxate the jaw in any way or fashion. Just straight ahead, pushing, hold for 10 seconds. And you're good. So to summarize, looking down here for the anterior compartment, we need to stretch this out. And then you can go right into strengthening the posterior neck by pushing in and holding for 10 seconds. And you do those, 10 of those twice a day, morning and night, along with your icing and chiropractic adjustments, and you're on your way to whiplash recovery.